Start. Thank you so much for making time to join us this afternoon. And for those joining us virtually, thank you so much. Good morning, good evening, good afternoon from wherever you are tuning in from. This is our session on climate resilient and just health systems in Africa. My name is Liz Ntonjira. I'm the Global Communications Director at Amref Health Africa, and I'll be taking us through today's session. As you know, what has been taking center stage in COP27 is the issues of climate action. And we are facing a triple crisis that is occasioned by climate, health, and economy. And in this particular session, we're really trying to bring into perspective an integral topic area, which is that of health, the nexus of health and climate change. And we've realized for a long time that the impacts of climate change, one of the industries and systems that faces the biggest or bears the biggest brand is the health ecosystem in any country. When there are floods, health facilities are washed away. From a very great example we were given in Uganda, for instance. When there are floods, there's disease outbreak. When there's drought, there's an emergence, and when there's drought, when there's air pollution, when there's water pollution, there's an emergence of new diseases that come up. But then when we're talking about climate and health, health has often been taken to the periphery. How do we make it an integral part of this discussion? Those are some of the outcomes we hope to achieve in this, what's going to be a very engaging session. And the other outcome we hope to achieve is to find out the status of the Libreville Declaration. What has been the outcome to date? What has been the outcome of ATACH that was born out of the COP26 deliberations in Glasgow? And also, finally, how can different partners in different ecosystems work together towards a shared vision and goal instead of working in silos? Those are some of the things we hope to achieve. And with me this afternoon is a distinguished panel of what I would love to call climate action activists coming from different sectors, the civil society sector, the NGO, the government, the multilateral organizations, and our very vibrant youth. And we're going to hear from all of them this afternoon. The runoff show will have Adenike Titilope, who will start us off. She is a youth climate activist, and if you've been following these conversations, she wouldn't be a new face for you. She has been front, back, and center advocating for the role of women and girls in the whole conversation around women, around climate change. Will be followed by opening Those are some challenges, tech challenges, so please bear with us. Everybody has been experiencing them. Followed from the curtain raiser by Adenike Titilope from Nigeria will be Honorable Eisenhower Mkaka, the Minister of Natural Resources and Climate Change from Malawi, who will give a keynote address on some particular issues around the actions on the Libreville Declaration and pertaining Africa's and the continental-wide response to climate action. Thereafter, I'll be joined by a distinguished panel that consists of Dr. Maria Neira, who, if you were here earlier, was part of the panelist of this fascinating video from BBC on some of the critical or impacts of climate actions. Dr. Neira is the WHO Director in the Department of Environment, Climate Change and Health. I'll be joined by Dr. Jenny Miller, the Executive Director, Global Climate and Health Alliance. I'll be joined by Dr. Githenji Gitahe, the Group CEO of Amref Health Africa, via video on his contribution on this really important discussion. And I will be joined by Professor Akin Abuyomi, the Commissioner of Health for Lagos State, Nigeria, And last but certainly not the least, Adenike will be joining us back on stage on the youth contribution and the role that the youth play. So without further ado, I would like to request Adenike to come here as our curtain raiser. A big round of applause for Adenike. Please stand here.
Okay. Thank you so very much. As we all know, climate change is linked to health issue. That means climate change is the biggest threat. That means climate change is the biggest threat to our health system. A very good examples or indicators that affect our health system is the floods, the drought, food insecurity, and other issues that defines us. For example, the flood that happened in Nigeria definitely led to the outbreak of cholera, and it has affected thousands of people because the loss of life also, like 600 people died from the flood crisis. And it has been known that by 2030 or 2050, that the health cost of the climate change crisis will lead to $2 to $4 trillion annually. At the same time, 100 million people will fall into poverty, because one of the great indicators of health challenges today is the loss of livelihoods. Then water. The ability for people to be able to access water. Just for example, I advocate for the restoration of Lake Chad that have shrunk by 90%. And so lack of water affects people access to clean water and other purposes, for agricultural purposes as well. At the same time, oil spillage, for example, in the Niger Delta, affects people to have safe drinking water, which definitely leads to diseases. And at the same time, the COVID-19 has been linked to the climate change crisis that has led to the death of millions of people, affecting thousands of lives and their livelihood at the same time. And so if we don't act against the climate change crisis, it will lead to more pandemic, more health issues that are linked to the crisis that we have faced, both existing and new crises. And so I want us to act like climate change is a crisis, that we should include health-related issues in our deliverables or in climate-related actions. That climate change is affecting every sectors: health, environment, transportation, agriculture, and everything that defines us currently. If we don't act, then we might be in a world where it's going to be faced with more pandemics, more crises, beyond loss and damage. Because if we don't act now, it's even beyond adaptation currently, that we can't even adapt to the climate change crisis once it happens. Because it has already been mentioned by the Intergovernmental Panel on Climate Change that if we could act now, it's going to prevent us from crisis. That for every percentage or every rise in global warming, that it always leads to increase in diseases, both new and existing disease. And so I want us to act. I want us to come up with policies that will help our environment, that will also help the people as well, because our diversity is also being faced with the climate change crisis. And our lungs, just like this, is the one bearing the brunt of this crisis. And so also those people displaced by the climate change crisis also lack health safety facilities, affecting the United Health Coverage objectives. And so also are women and girls, that once they are displaced, it affects their ability to have right to health and the rest. And at the same time, women and girls trek distance. It also decimates their health at the same time. Imagine you trekking 2 kilometers, 3 kilometers, 20 kilometers as you can go to search for natural resources. And also using firewood also affects women and girls' health and makes them to have short-term lifespan. And so that is why we need to act. That is affecting everything is affecting humanity as well. And the time to act is now, that we cannot even wait for 2030, 2050, because the more we prolong climate justice, the more it affects our health system and brings it down. And we know countries like mine that are developing lack this access to the capacity to adapt to this crisis. When the COVID-19 struck, it was done on us that we need to take care of our health system to survive the climate change crisis. And so we need to prepare now. Those policies, those laws that we need to put in place have to start from now. If we don't put them in place now, it will be difficult for us to checkmate all of those things when it's strong. We don't have to wait for when it results to the loss and damage, leading to the loss of life, because once lives are lost, it's very difficult for us to regain them. And so those are the inevitable impacts of the climate change crisis that are even beyond finance, like the loss of identity, the loss of health that could become irreversible. So I want us to act. I want us to come up with different initiatives. And the time to act is now. Thank you.
I think Titi Lope deserves another hearty clap. I mean, if we don't act now, the more grave the repercussions are becoming, particularly on health. And her key message is act now. Now, I want to ask a quick question. If you've been affected indirectly or directly through climate, please raise your hand for those in the room. And please feel free for those who are joining us virtually to raise your hand, your virtual hand. Literally everybody in the room has been either has been affected indirectly or directly by climate change. So it's time for us to act now, and everybody has a role to play. Without further ado, I now invite Honorable Eisenhower Mkaka for his keynote remarks. Thank you.
Thank you very much, Madam Moderator, Your Excellencies, ladies and gentlemen. Allow me to start by expressing my gratitude for being invited to speak at this important meeting on climate change and health. Climate change impacts have not spared any sector. Hence, it is important that these interlinked issues are dealt with together, especially at this time when our countries are seeking to achieve universal health coverage by 2030 as part of our commitment to the Sustainable Development Goals. Your Excellencies, we cannot talk about achieving universal health coverage without us implementing activities for mitigating the effects of climate change on health. In my country, for example, despite significant progress made during the past years in building resilience and strengthening capacity of the health sector, the sector remains among the most vulnerable to the impacts of climate change. The increase in extreme weather events contributes to the worsening of people's health status and damaging of health physical infrastructure. Climate change also influences disease burden pattern of some infectious diseases, that is climate-sensitive diseases such as diarrhea, bilharzia, and malaria. In 2019, for example, when my country was hit by the cyclone Idai, we experienced an increase in cases in the affected districts of Chikwawa and Nsanje. This year, the tropical Ana and Gombe also resulted into cases of cholera impacting several districts such as Chikwawa, Nsanje, Mulanje, Palombe, Zomba, Mangochi, Machinga, Balaka, and Nkota. A good number of them. Your Excellencies, the Libreville Declaration has contributed to building and improving partnerships for targeted and specific advocacy on health and environmental issues. It is based on the recognition that good, sustainable environmental management promotes good health and averts the need for certain types of investment in public health, hence having scarce financial resources for other public health interventions. As the old adage goes, prevention is better than cure. Malawi is committed to facilitating access to funding for the implementation of country's climate change and health activities. The activities range from increasing the resilience of health systems and reducing emissions from the sector. The country is in the process of developing a health sector strategic plan 3, in which issues of climate change are one of the priority areas. Development of the health sector strategic plan 3 is being guided by Malawi's Vision 2063 document. The plan will consider the potential of the health sector to contribute to emissions reduction, to the emissions reduction target of the country, while following a sustainable and a resilient health system approach. We have already started installing solar systems in most of our health facilities instead of installing diesel generators for electricity, and we plan to buy energy efficient pieces of medical equipment that will allow with low carbon emissions in nature, and in this way we will reduce the health sector's carbon footprint. Excellencies, ladies and gentlemen, this builds on the interventions my country has been implementing since 2014 under Global Framework for Climate Services, GFCS project, funded by the Norwegian Ministry of Foreign Affairs, and Delivering Climate Resilient Water and Sanitation in Africa and Asia project, funded by Foreign Commonwealth Development Office. Remarkable achievements have been registered, such as development of 1. Malawi Vulnerable and Adaptation Assessment Report 2017, 2. Health advisories on extreme weather events, 3. Health Sector National Adaptation Plan, 4. National Communication Strategy on Human Health and Climate Change. The project also increased capacity of health workers and communities by facilitating the integration of a module on climate change and human health in the curriculum of some health training institutions and community training manuals, and established multi-sectoral health and climate change core team for coordination. Your Excellencies, ladies and gentlemen, despite all these efforts, adequate and predictable funding remains a key challenge to advance health and climate priorities at national level. There are limited funding opportunities for health and climate change interventions. Hence, we fail to adequately implement the plans we have developed, such as Health Sector National Adaptation Plan, Vulnerability and Adaptation Assessment Recommendations, and nationally determined contributions. Considering that there is a political commitment and will, and plans and policies are available, I would like to appeal to the development partners and multilateral climate financing institutions such as Green Environment Fund, GEF, and Green Climate Fund, GCF, to strategically consider funding for climate change and health initiatives, not only in Malawi, but in all developing countries. Your Excellencies, ladies and gentlemen, I want to extend words of appreciation to all our partners for the support they give to our countries in adapting and mitigating the effects of climate change. A stronger focus on primary prevention places a health environment at the center of the health agenda. This is not to this is a task for ministries of health and environment. This is not a task for ministries of health and environment alone. There is an opportunity for sharing best practices and adopting and adapting innovative solutions. Indeed, A Pan-African multi-sectoral partnership on climate change and health will bring more effectiveness and efficiency in coordination, which will help decision makers from the various sectors to work together at national and continental levels to deliver climate resilient and just health systems. Thank you for your kind attention.
Thank you so much, Honorable Mkaka, and it is such kind of commitment, political will, and political missions that we need in terms of us being able to achieve what we hope to achieve in the impact, in mitigating the impact of climate change on not only health, which bears the biggest brunt, but also other industries. How can all these ministries work together? The Ministry of Environment, the Ministry of Health, the Ministry of Agriculture. How can they work together in the different countries so that then whatever discussions were done in the Libreville Declaration, what was committed by 22 African countries in the ATACH, pegged on the COP26, how can we fast track that movement? Thank you so much, Honorable Mkaka. We do appreciate the commitment that Malawi has taken and being at the fore of ensuring that this climate change is a priority in the country. Thank you so much. I'm going to invite our panelists to please come to the podium. And I would ask our organizers to please help with just 2 more seats that we need at the podium. Please do take your seats. Prof. Akin, please feel free to sit anywhere. Adenike Tutulope, please do take a seat. Dr. Jenny Miller. And Dr. Maria Nera. And we'll have a video contribution from Dr. Githenji Gitahi. For now, the discussion that we're going to have, I'd like you to see the contextualization of that discussion on our first video that we're going to play for you. I hope it's audible for both our in-house and virtual guests that are joining us today. And I want to refer to you as discussants because you are discussants in this conversation. And we're really looking to having a productive engagement around this. The first video, please. We need sound. And you've seen the staggering statistics that have been played, and we do invite you to join the rest of the world as we demand action to be taken in terms of mitigating climate change and its impact. Now, just to refresh your memory in terms of our distinguished panelists, who I'd love to call climate action activists in their own different individual and collective capacities, I will start to my far left. We have Dr. Maria Neira, who's a director at WHO in the Department of Environment, Climate Change and Health. We have Dr. Jenny Miller, who's the Executive Director, Global Climate and Health Alliance. We have Ms. Adenike Titilope, who's a Nigerian climate justice activist. And last but not least, on the podium, we have Professor Akin Abuyomi, the Commissioner of Health for Lagos State in Nigeria. And a person who's not here with us today, but there'll be a video contribution, is Dr. Gethenji Gitahi, the Group CEO of Amref Health Africa. Now, I'm going to start with a topic that has superseded or just comes, we're in COP27. And there was this great document from COP26, the ATACH. Dr. Neira, over to you in terms of where are we with that? What have been the processes? What is the status? What are some of the commitments? And what are some of the pain points? I know it's a very fully packed question, but it's something you're very passionate about.
Thank you so much, and it's a pleasure to be here. Hello l'Afrique. I know that there are plenty of francophones. Bonjour l'Afrique quand même. On ne veut pas vous discriminer avec la langue. Il y a des francophones ici dans la salle? Bonjour la francophonie quand même. Okay, let's move to English again. But thank you so much. It's such a pleasure. You know, one of the reasons why it makes me very happy, those two health commitments that we took at COP26, is because they are very much action-oriented. And I think the health community is a little bit fed up, if you allow me to use that expression, to do a very good diagnosis, but we feel frustrated that we cannot move from the diagnosis to propose a very good treatment. So those two health commitments from last year are prescriptions that we made as the health community, and now we are moving on treating our patients. One of the commitments is to make our healthcare facilities more climate resilient. We need to make sure that they are not only low carbon, but climate resilience, and accelerate access to sources of energy. Of course, clean, sustainable, and friendly sources of energy. So essentially, on a nutshell, we want to electrify with solar panel any single healthcare facility in Africa. What is that? Is that ambitious enough? How do you feel about it? There is no reason why we will not be doing it. If there is something that is a free resource in Africa, it's sun. So no excuses, the technology is there, the cost of the renewables are going down, and the technologies are getting more and more friendly use, and we have the capacity to make sure that those healthcare facilities in Africa that they do not have now access to electricity, or if they have it, is non-reliable, they should be electrified, and then we will be able to provide the services that we want from a medical point of view, plus making those healthcare facilities less dependent on fossil fuels like diesel generators that they are using in most of the occasion. The other health commitment is the so-called ATACH. We want to decarbonize the health system, means those healthcare facilities or hospitals that are already contributing to the carbon footprint, they will be happy to join this alliance, the ATACH. We have already, I understand, 64 from today, countries that has signed ATACH to reduce the carbon footprint of the health system. You know that altogether, globally, the health system contributes to 5% of the global carbon emissions. Of course, our hospitals need electricity. They are very electricity intense demanded, and they need to keep with that. But what about if we move to reduce in terms of supplies, procurement, energy efficiency, and change in the sources of energy, and we make our healthcare facilities zero carbon, hopefully in 20 years from now. So I'm very excited about these two commitments, because we think that the health system, the health community can lead by example, and demonstrating that this is feasible. We contribute, we generate some motivation among the health professionals, and hopefully we will keep putting pressure on those who need to accelerate this transition to renewable sources of energy and stop the combustion of fossil fuels that is literally killing us. Over to you. Oh, sorry.
Thank you so much, Dr. Neera. And it's fascinating that you talk about the role the health sector has, especially in the infrastructure. And earlier in the last week, it was quite interesting to see that these commitments are actually being actioned. We took a field visit to the Egypt Health Authority, where there's a field, and if you haven't, I encourage you to please do so, to go to the green zone and check out the field hospital that is there, because it is fully running on solar. It has an MRI machine, it has an ICU, it has outpatient, inpatient, everything that is needed in a health facility. So those are commitments that we are seeing being actioned. Thank you so much for that. Dr. Miller, let me come to you in terms of the institutional arrangements that have been put in place. How are they, as a civil society organization lead, how are you ensuring that they are being fast-tracked? What people committed to, they're actually actioning on what they committed to as far as health is concerned.
Yeah, I'd really like to, well, first I want to say that the previous speakers, the Honorable Minister, our esteemed youth speaker, and Dr. Neera have made my job easy for me, because you've already referred to some of the things that I, from the civil society point of view, would recommend, and that my organization and our many members and partners have been advocating for. The first piece that I want to reference is the preparation of health workers. So we know from health workers, health professionals, doctors, nurses, as well as public health and community health workers that know about climate change, that they do not feel prepared. They do not feel prepared to care for their patients in this changing world. We also know that many health workers and health professionals do not yet understand climate change and know about it. And so one of the institutions that I would like to point to is the preparation of our health workers, the curriculum, as the Honorable Minister referred to, in the preparation of health professionals, doctors and nurses, the training programs. And why this is so important, thank you. This is so important because when health workers are well prepared and well trained and well aware of climate change, they can support all of the changes in the health systems that the ATACH network is calling for. They can be champions within their own health systems. They're going to be the ones implementing some of these changes, and they are very important to that transformation. In addition, we have seen that health professionals and health workers can be very strong champions in the broader world in calling for the cross-sectoral changes that need to happen. So that brings me to the second component, which again, all three of the previous speakers have referred to, and that is the institutions across sectors. So we know that for a health system to be resilient, for it to be decarbonized, it cannot do that alone. It depends on energy systems, it depends on transportation systems, it depends on food systems, as well as supply chains for medications and waste and so forth. And that requires a whole of society commitment to these changes. And I believe, if I recall correctly, that my organization did an analysis of the nationally determined contributions that every country is required to submit under the Paris Agreement. I believe that Malawi scored very highly, and that's because Malawi built in health across its commitments on mitigation, on adaptation, on assessing impacts, and on financing. So that's the kind of cross-sectoral, whole-of-government approach to integrating climate change and integrating health. And what we know is that if you build health into your climate solutions across sectors, you get better policies, you get more health co-benefits, you get better outcomes.
Thank you so much, Dr. Miller, for that. And I'll be coming back to the question on financing because it's a big one. It's the elephant in many rooms in this COP27. I want to go to Adenike because there's this amazing, vibrant youth movement that is being led by different young people from different countries, different regions, that is very adamant and very proactive in terms of the change needs to happen now because future generations are relying on it. There's that movement, and then there's the policymakers who maybe seem not to keep up to pace with the fast tracking of the youth movement. What have been some of the initiatives and some of the things that you've been doing in your own activism to ensure that governments and policymakers are not left behind and that the youth voice is being heard?
Okay, thank you so very much. I really feel like young people's role should not be limited. Like we could be policymakers, innovators, we could be different parts of our society, not just implementers or volunteers or the likes. So as the founder of I Lead Climate Action, one of those things we do is to try to champion youth voice. Around the world, especially in Africa, looking at the fact that if we have youth negotiator in the room, it will improve the processes, just like getting the Nigerian badge. It helps to improve the process of the negotiation process when youth take part in the negotiation process. And as well, trying to champion issues on climate action, that we need climate education, because I believe that if you don't understand that a problem exists, you can't even solve it. So the first thing is to get aware, then you get to understand how we could all solve the problem together. And looking at the fact that climate change is not just limited to the environment, it's all interconnected: agriculture, transport, housing, health, different things. I studied agricultural economics as a first class graduate, but then I feel like the impact is even far and near reaching, because I schooled where the clashes between the farmers and the herdsmen are rapid, and this is because of the fact that they don't understand that it is lack of or the depleting natural resources that makes them to clash a lot, because the farmers and the herdsmen, they both depend on the same resources. They depend on land, they depend on water, and also being affected by climatic factors. And so I draw inspiration from those experiences and feel like educating people could help to bring solutions on the table together, because I alone cannot just bring the solution. We need different people from different sectors to bring the solutions on board, and also trying to see how we could use geospatial in addressing issue of Lake Chad, which I got a fellowship for a residency in Germany next year, to see how we could address Lake Chad using different issues of mappings and then providing solution through that means, in order to see how we could provide resolutions of different kinds for policymakers. And I once challenged the IPCC authors during my interview that, okay, during the IPCC process, you could also include young people to take part in this process so as to better the process or the outcomes of the result, because young people can never be limited on their roles and which they could play, that beyond the implementation, they could also be involved in the process so that they become part of it and they're able to execute it perfectly. And so different things we do.
Thank you so much, Adenike. Your point on no one being left behind, ensuring that we're all moving together. And I feel like your point also transcends on the point that Dr. Miller was saying on capacity building. How do we ensure not only the health workers are being educated on the impact of climate change and how they carry out their work, but also how do we educate communities on the impact of climate change and what are some of the mitigating initiatives they can undertake to support. It's a whole ecosystem. Thank you so much for that. I'll move over to Professor Akin, who's the Commissioner of Health in the state of Lagos. And for those in the room who did not know, Lagos is the fourth largest economy in Africa. Am I right? Exactly. So you can imagine it's really big. In terms of the framework of cooperation between the environment and health, how is the status in Lagos with 30 million people, with a population of 30 million people, and what is the status of implementation, and what have been some of the pain points?
Thank you very much, and a pleasure to be here amongst these distinguished panelists. Well, I think first and foremost you need a lot of political will. And you can see in this room I'm accompanied by several of my colleagues, the Commissioner for Economic Planning and Budgeting, the Commissioner for Environment, the Special Advisor on Strategic Development Goals. And we've accompanied our Governor, His Excellency Mr. Babajide Sanwo-Olu, with a very large entourage to COP27. The reason for this is that Lagos is a mega city that won't stop growing. It's low-lying and it's coastal. And it's got this large population on a very small footprint. So there's a very high human density, which makes us particularly vulnerable to climatic shocks and biological shocks. So the sea is trying to flood the land. We've got rivers flowing into Lagos as a delta. A third of Lagos is water. And we've got this huge population in there. So we've done a very strategic analysis. And we've come up with a climate adaptation and resilience plan, which our governor is going to present here at COP27 tomorrow. And inside this plan are various facets. There's environment, there's transportation, there's agriculture, there's health, there's urban planning, there's justice. And we're coming to present this plan because we have figured out that if we are not active or proactive, we're going to incur up to $30 billion in climate catastrophe in the next 10 or 20 years. And so a stitch in time saves 9. And we know now that we've calculated what we need to do. We need to spend about 9 or 10 billion over the next 5 or 10 years to prevent this high catastrophic consequence of economic shocks that may arise out of climatic perturbations. Now, for us, we already have an agenda. Even at the beginning of our administration, with the governor put health and environment in the same silo, already recognizing the close relationship between environment and health. And we've taken that a step further, and we've adopted the WHO One Health paradigm. I think we're one of the first governments to do that. We set up a special committee where we've been discussing how to develop policies and guidelines around One Health. And for those of you that don't know what One Health is, it's the relationship between health, agriculture, and environment. So we're looking at health very holistically. You can't be a healthy person if you're living in an unhealthy environment or you're eating unhealthy food. So COVID also showed us the close relationship between environment and health. So what we're doing in Lagos is to present this adaptation plan. We are also in the health sector. We are developing climate doctors. We've developed a biosecurity roadmap, where we're training doctors on what to look out for as climate consequences in health. One of the biggest things is biosecurity, because when we talk about biosecurity, we're talking about maintaining the health of the biosphere in which we live. And we know that if we disrupt that biosphere, we as human beings are going to be the casualties. So we've got a very strong biosecurity roadmap, and we're developing that. We use that to fight COVID, and we were very successful in Lagos, because Lagos was the entry point of COVID into Nigeria, which is 20 million population. We also have a very unique climate change resilient infrastructure plan. So what we've recognized is that our hospitals and our clinics are very heavy on fossil fuel dependency. So we've done two things. We've designed new blueprint facilities, which we're now building, both at the primary healthcare level and the general hospital level. They're very low in carbon to build. To run the facilities, a lot of them will be off the grid, or the big hospitals will at least have a much lower carbon footprint in terms of operating these facilities. We also designed them not just for low energy consumption, but we looked at the flow of patients and the flow of doctors and health professionals through the facility. We looked at the consequence of infectious diseases. In COVID, we learned that our old hospitals were inappropriate because patients were collecting in waiting rooms with very little ventilation, and when there's no electricity, the ventilation is even worse. So now these new facilities we have, which are what we call the governor's blueprint, we're beginning to build them now. They're very low in carbon, they're well ventilated, they're suitable for equatorial climates. They have natural cooling facilities. We looked at where the sun rises and where the sun sets. We looked at where the wind blows. And so these buildings will be structured in such a way that they're natural, eco-sustainable, eco-resilient buildings. And I think in the next 4 or 5 years, we're going to have a very low carbon footprint health sector. Now, you asked what our pain points are. Well, the whole climate agenda and development are diametrically opposed. If we want to industrialize as fast as the developed world industrialize, we're going to be heavy on carbon footprint. So now that everybody has to cut down on carbon, we have to find a way to reach that same level of economic development without using cheap energy, of which we have abundance. We have coal coming out of the ground. We have oil coming out of the ground. We have gas coming out of the ground, but we can't use it. Or the climate agenda tells us you can't use it. So what are we going to use to develop our economies? So there's a very fine balance between economic development and the climate agenda. When we did our climate adaptation and resilience plan, we discovered that we needed $30 billion to make Lagos climate proof. Where are we going to find $30 billion? So that's the pain point. We've put it's not a fabrication. We've done all the calculations. That's what we need. We're here to solicit support and help. We're going to start. We've already started. It's not like this is a piece of paper. We've been building a climate resilience economy for the past 4 or 5 years. We're a significant way down the path. We're just going to keep going. We're looking for funding. We're looking for partners. And of course, we're always going to solicit higher income generating projects in Lagos State. Thank you.
Wow. Absolutely. That deserves a really hearty clap, because one of the things you did mention is political will, and that's what we're feeling in the room today. From the presentation and the keynote from Honorable Mukaka, from our commissioner in Nigeria, we can see that Nigeria has been hard at work ensuring that it becomes climate change proof in terms of how it's carrying out its activities. But the bigger question is in the pain points and how do we overcome those pain points. Partnerships is one of the things that is really critical, and South-to-South learning is also very critical in this journey. And the South-to-South learning is what Nigeria is doing, what Malawi is doing. In a previous panel, I could see what Uganda was doing, what Ethiopia has been doing in their 15-year initiative. Really fascinating lessons to learn from. But what is the role of partnerships and the importance of designing a Pan-Africa partnership that really responds to the ATACH commitments that were made? And that's something that Dr. Gethenji Gitahi is going to tackle in his video contribution. So if we could please play the second video. Thank you.
Thank you for allowing me to contribute to this debate on the sidelines of COP27 on climate change and health, and how to create multi-sectoral partnerships. Amref Health Africa is hosting this session in addition to previous sessions that we've held at the World Health Assembly in Geneva and also at the UN General Assembly in New York, to really discuss what does work or activities or action around climate change and health look like. And this session that we are having today is starting to look at how do we build on existing initiatives that are going on, including the Alliance for Transformative Action on Climate and Health, which is WHO-led, but bringing together many other partners and governments to see how we really drive this agenda on health and climate change. I would like to tell you that, for one, I attended COP27 in person last week, and I noticed the absence of health as a key item on the agenda of COP27. And then, of course, the WHO pavilion, and we must thank WHO for putting this together. We're finding that the health agenda in climate change is not central to the conversation. And this is what we need to work towards, so that by the time we get to COP28, we actually have health at the center of the climate change activity. Because, for health, we are saying that the entire climate change agenda is not just about the planet. It is also about lives and livelihoods. And lives and livelihoods are at the center of the climate change action, because without people, without healthy people, then we can't have a healthy planet as well at the same time. So this agenda is, how do we then bring together all different partners and create a multi-sectoral partnership platform that we can build this agenda on to ensure health in several areas. One, looking at vulnerabilities of communities and countries to climate change. How is it affecting their lives and their livelihoods? Secondly, what programs do we need to put in place to ensure that we can build adaptation to actually protect and build people's lives and livelihoods for a better future? And then what kind of financing and governance and community participation agenda do we need to bring in? But none of this can happen on its own. And therefore, Amref Health Africa and our partners are looking at how do we actually create this multi-sectoral partnership platform. Now, for one, we know that climate change is a multiplicity of issues. On one side, of course, we have the fossil fuel conversation. So those people who are actually addicted to fossil fuels, we need to be allies to ensure that they are working together to save lives and livelihoods. Secondly, we need the health sector to work together, not only to reduce its own carbon and greenhouse emissions, but also to work together to build resilient health systems that protect people. Thirdly, we need agriculture in the room, because nutrition is part of building healthy lifestyles. And then we need also to bring the people from the environment sector, because this is about ensuring that we have a sustainable planet, and planetary health is part of driving healthy populations. But we also need to look at who are these other different people who need to be there. Of course, this whole action needs to be led by government. We need private sector in the room. We need civil society. Civil society not only at a global level, but at a local level, at the community level, at the people's representation. And all these voices must be brought in, irrespective of their language, their socio-economic status, their ability to travel to the global health arena. They must be able to contribute from where they are. We must be able to bring in people, to bring in the lived experiences, or voices that bring in lived experiences. It is not going to be easy, but we have to start now. The best time to start is now, and I'm glad that we are having this conversation. And all these partners, then we have to ask ourselves, what does each of them bring? Remember that we need people, we need resources, we need financial resources, we need knowledge. And we must be uncomfortable and go beyond the partners we are used to. Often in the health sector, we tend to talk to ourselves. It's almost like an echo chamber. We need to bring in, for example, the public development banks, the multilateral banks. We need to bring in private sector that we've not worked with before. We haven't worked with agriculture development. We haven't worked with people who are actually in climate finance. We need to bring in the Green Climate Fund. We need to bring all these people. So I'm hoping that this particular session can actually delve into not only the who, the what, but the how. And thanks for having me contribute to this discussion. And I look forward to the outcomes and taking them forward for a better COP28 and a better future. Thank you.
Thank you so much, Dr. Githinji Gitahi. And the how is, how do we continue these conversations, ensuring that no one is left behind? Just going to the point that Adenike did speak about. And these conversations are still ongoing with our Health Agenda Conference that will be held from the 6th to the 8th of March next year in Kigali. And we have shared some posters with you to continue this fantastic conversation. Now, before I get to the questions, because I did say that you are discussants in this particular session, so I'm hoping to hear from you either contributions, feedback, commitments that we are making from the floor, as well as questions that you may have. I want to pose a question to, and Dr. Nera, this goes to you. As you know, the ATACH, the different frameworks that are developed, one of the biggest things that each panelist has talked about is the financing bit. What is your recommendation in when this document, because there will be another document that will come out of COP27, it would be really great to see that these frameworks are supported by a financing model that will support countries achieve these really ambitious targets. Any comments on that?
Yeah, thank you. ATACH, as you know, has been formally launched only a few weeks ago. And one of the working groups we have set up is about financing. As you know, a couple or 3 days ago, we had here a big meeting launching this financing part. We invited different partners. It was the Green Climate Fund, there were different governments, the hosting countries of the COP. We hope that this critical issue could be, we could offer some solutions or at least some channel to finance support to those incredible projects like the one described in Lagos. The Green Climate Fund, as you know, has been, until now, maybe the process to assess the funds have been very encumbered, but we have the reassurance now that they will accelerate with all of that. So we hope that we will be able to offer at least some mechanism and procedures facilitated to give a space to all of these wonderful and challenging and championing projects that I'm sure that then will be self-maintained in the future. Thank you.
Thank you. Thank you so much. Questions and contributions from the floor? Yes. Lady in blue.
Hello. You can hear my voice?
No.
Hello. Well, first of all, thank you so much for mentioning Egypt Healthcare Authority. I am a technical officer there, so thank you so much. And you should visit Sharm el-Sheikh International Hospital too. We did there a great job. I would like just to talk about financing thing too. It was an issue while we were working on Sharm el-Sheikh Hospital. We searched a lot for finance, and that was a problem because most of the funds are dedicated to environmental issues. There's nothing related to health, and whenever we tried to find a fund, it was always with the Ministry of Environment, and I think it's always their priority to do their work. Nothing is dedicated to health and climate change. So I hope we can just, find a way to like merge them, or to find, to direct or make something dedicated to health and climate change. Thank you. And I would like to thank you again for Egypt Healthcare Authority.
No problem. Thank you so much for that contribution. Again, it focuses on finance. And since we're on the finance topic, I'd like to ask Prof. Akin, and then I'll move to Dr. Miller on, as a country, it seems you've really prioritized climate and health. Has this been part of even your budgeting itself? And what would be your recommendation to other countries as well?
So, as you can see, I'm accompanied by the man in charge of the budget in Lagos and my colleague in charge of environment. So we've come as a team, and that demonstrates the highest level of political will. And our governor is coming tomorrow, and we're here as part of his entourage to talk about not only what we need to do, but how to get the funding to do what we need to do. So of course we have to look internally as well. You know, we got to look at how to squeeze money out of a budget that is heavily prioritized to deal with a multitude of problems that we have in Lagos. But also we're going into a retreat in a few weeks' time to look at how to bump up the IGR of the state. You know, where can we go in the state to look for more funding that's going to fuel this agenda that we have on climate proofing the state, because we recognize that we're so vulnerable. We recognize we need to pour resources into it. And, you know, so we're here not just to spread our message, but also we're projecting Lagos as the model mega city of Africa, you know, and so it requires us to team up with our colleagues across the continent and see what ideas we can exchange. You know, what are people trying in different parts of the continent. We're just a city that won't stop growing. Everybody's coming into Lagos, either from Nigeria or from the sub-region, and so we need to be proactive, you know, and we need to work on financing mechanisms. Now, for us in health, we've discovered and we've just introduced a new initiative which is around insurance, social health insurance, which is a very important way of financing health, because you can't just look to government to provide free funds, to provide free services. We've just enacted We've just passed a law in the country that makes it mandatory for all Nigerians and all Lagosians to enroll in a social health insurance scheme. And that is a very important way of financing health, because that fund is a pooling mechanism, and everybody knows how insurance works. It's not, nobody ever needs insurance all the time. So your funding goes into this pooling mechanism, which can be cross-subsidized to provide both the demand and the supply side in the health economics. So we're driving a health financing agenda, not just increasing the budget of the state. We're looking at opportunities to increase income generation across the sector, and we're looking at this innovative idea around mandatory health, social health insurance.
Thank you so much, Prof. Akin. I know when we're talking about, and Dr. Miller, I'd love to hear from you as we come to you for the next question or comment. The messaging of climate action has been one of the biggest impediments to even accessing funds, because often people talk about the future and you have people dying now because of drought, because of floods. The messaging has to change to ensure that either philanthropists, either governments dedicate these monies into the requisite mitigation initiatives that need to be done. What has been your experience, and what is your recommendation to different sectors of groups in terms of the financing model?
Yeah, I think that's very right. Looking at climate change as a future problem is completely misplaced, and it has been for a very long time, but I think that's now more recognized globally and not just in countries that experience the greatest impacts initially. On the financing front, the health community, the health civil society community around the world has kind of come together to call for stronger funding for the Green Climate Fund. The funds that have been promised were not yet delivered, but also for that fund to be allocated not only for mitigation, but also for adaptation, and also for that fund explicitly to include funds for health. So right now, that's not a particular focus of the fund, and it does make it very hard to access funding for projects. In addition, coming into this COP, we've made a call for financing for loss and damage. We know that countries are experiencing significant impacts, countries that have not been the drivers of climate change to date. High-income countries that have historically driven the climate crisis have the resources, have the responsibility, and have a duty to step up and provide some of that funding. currently, the kinds of the amounts that we're talking about with the Green Climate Fund, we know that those are completely inadequate to addressing the burden of climate change, the kind of resilience we need to build, the kind of adaptation we need to make, and the kind of mitigation that we need to be doing. So, and we also saw during the COVID pandemic that funding can be liberated to do things quickly. Systems can change quickly if there is a sense of urgency and if there is a recognition and the political will, to Dr. Hakim's point. So that's, I think, those are some of the issues that we're seeing from the civil society perspective, and I think building that political will is critical.
Hi, do you hear me? Okay, great. Amanda with London School of Hygiene and Tropical Medicine. I just want to mention that it's very, very exciting to hear what Lagos State Government is doing. I had a small stint with the Lagos State Government in 2018 working on urban climate resilience when the Resilient Cities Initiative was first launched in Lagos State. And there wasn't really that clear messaging on how the health community was working across this new initiative, but it's so exciting to see a delegation here. And my question to you is something that has come up in my research a lot is how you work subnationally with the national government. So while you're here, are you working with the Nigerian delegation to push what you're looking for to finance, for example, the health agenda as part of your planning? Is there other maybe agreements or maybe more tangible examples that you could give us on how you work within the country subnationally and nationally? That would be really helpful. Thank you.
So, since Lagos State is a subnational, and you're quite right. So what we've decided to do, because the climate negotiations happen at national level. So a subnational can't engage in climate negotiations. But we have to influence our negotiators, to push this agenda around loss and damage and around the doubling of adaptation financing, and also making Africa a very special, situation where our needs and circumstances are totally different, because they say that Africa is going to be the most impacted by climate change over the next 10, 20, 30 years. So I think in the negotiations, it is incumbent on us to support the national negotiators to achieve these objectives that we've just heard, increasing financing for climate change, increasing loss and damage, or at least putting it on the agenda. It's not yet on the agenda of the Paris Agreement. So, we've got to push it in there. And Africa needs to make a case for doubling of adaptation. As we all know, we're not responsible for the greenhouse gases that are now impacting us in such a severe way. So we do deserve a special concession as a needs environment. And we've got to be very aggressive about that negotiation. So what we're doing in Lagos is working with our national negotiators to push those points ahead, because there are certain areas of Nigeria that are extremely climate sensitive. Lagos is one of them, but the extreme north that borders with the desert is encroaching in Nigeria by 15 kilometers every year. That is wiping out huge resources by the year. And that's what's causing a lot of conflicts and migration problems in the country. So we've got to address this problem, and we've got to be aggressive, otherwise we face an existential situation.
Thank you for that. I know when a discussion is really interesting, time just runs by. I don't know if there's another question on the floor. Yes.
Okay, thank you for the opportunity. I think there are other areas we need to begin to look at. We agree that the adaptation issue is community-based, yet we pursue it internationally from country perspectives. So I think we need to figure out how to work with communities better rather than to lock out communities in favor of national government. The second point is that it is where the pain point is that the investment flows. We've not done a very good work as a globe connecting the adaptation challenges to corporates. Because if the communities are destroyed, then the corporates begin to lose income. So how do we model the risks in such a way that we can make direct connection with corporates? That way corporates can know today that they will lose business and they will lose leverage, right, if they do not participate. Otherwise, they view all of these things as grants, as aid, and all that, instead of real risk. The third point is the citizen. Today, governments basically get between 15 and 25% of incomes in terms of taxes from citizens. Now, it is what they do, the citizens do with the balance 75%, the way they save it, the way they invest it, and the vehicles which we make available for them, that then begin to see the huge amount of investment flow that is possible even internally. And I think we need to be more creative in pursuing that model as well. Thank you.
Thank you. Thank you so much for those contributions. Something that has also come up in terms of the localization agenda. And it really reminds me of Lao Tzu's quote that says, go to the people, love them, live with them, learn from them, start with what they have, start with what they know, and whatever initiatives that you have, you implement. When you leave, they will say, we did this together. So there is collective ownership on it. Thank you so much for those contributions. I don't know if there's a panelist who wants to comment on the 2-3 other points that were mentioned, which were really reflection points on what we need to do. Adenike?
Okay, thank you very much. I believe that climate change, it's a pandemic. Okay, climate change is more than a pandemic. And now that we have the opportunity to tackle it, it should be tackled, because it's going to get to the point where it becomes irreversible for us to make any changes. And that is where the problem lies, or the danger lies. And I also believe that climate finance is a vaccine at which we could use to tackle the crisis now, before it becomes so big. Because just a very big example is that of the COVID-19 pandemic. We saw how nations rise up to bring finance to be available for the vaccine to cure this crisis. So why is climate change different from this, when we know it's a pandemic that has no vaccines once it becomes irreversible? So we all have to work together for the same cause, to know that climate injustice anywhere is climate injustice everywhere, and that no one country is safe except every country is safe. And I usually mention that if Africa is not safe, Europe is not safe. So hence, nowhere is safe until everywhere is safe. Thank you.
Absolutely, well put. Everybody needs to be safe. One more contribution from the floor. I know we've run out of time. After that contribution or question, we'll have a quick round of closing remarks from each of the panelists before I invite Martin.
Okay. Yeah, I just want to appreciate our policymakers that are here from Lagos. They've been very wonderful, and they've shown a great political will. But I just want to remind them that they've done something that a whole lot of states have not done. They've stuck to the Abuja Declaration in terms of looking for funding for climate change, and then the health budget. They've increased the health budget from around 9% to almost 12% as we speak, and they are still going on to also work around getting it to 15% as said by the Abuja Declaration. So these are ways in which they are also looking at financing climate impacts on health, right, even from their own budget. Thank you.
Thank you so much for that. And this is the South-to-South learning that we'd love to see, particularly in the Africa Health International Conference agenda that's coming up on March 8th from 6th to 8th. Please check out ahike.org to just learn more and continue this conversation. I'm going to start with Dr. Neira, about 20 seconds, 30 seconds as a closing before inviting Martin, who can come and stand here in the meantime.
Even less, I will just remind us the title, Climate Resilient and Just Health System in Africa. We need to move on that.
I'll just add that working together and building political will is critical to this process.
Yeah, I feel like climate smart health system is possible if we could all work together for the same goal.
So I just want the world to recognize that we're like the frog in the pot of water that is slowly heating up. I think the world is starting to heat up. And if we don't do anything about it, just like that frog, eventually the frog is going to die. It's not going to jump out of the water because the water is gradually heating up. And I think we're not realizing that climate change is upon us. You know, and I'm so delighted to have such young people like this who are so climate conscious and so climate aggressive. If not for them, I don't think we stand a chance. Thank you very much. And I just want to thank the WHO for ATACH and all the initiatives that you've made. We're going to follow it word by word, and next time we come to COP28, we'll have more to tell you about it.
Thank you, thank you. I think our panelists deserve a round of applause. And for you too, our discussants for today, I'm going to invite Martin Moshangi, who's our Director on Climate Health Issues at Amref Health Africa, for just some closing remarks. Over to you, Martin.
So, thank you so much, Reese. Mine is actually to just simply say thank you so much. Crosser. Okay. Mine is to say thank you so much to our distinguished panelists. I hear very clear call. I hear very clear ones. Collaboration. It's all about behavior change and being aware about the things which we need to do moving forward for us to achieve the goals that we are setting. It's very clear about financing. And we are saying that we cannot do this alone. So we need all of us to act together in synchrony. So this is not just an event. We are looking at it as a journey, and a journey which is going to build a momentum that is going to help the health community to be right at the center of the climate change conversation. So we have a series of meetings, dialogues that we are organizing, including the African Dialogue, which is going to take place on the 15th of December. We are going to invite you, we're inviting you for a hike and many others. So let's do that, and I really wish you a very nice evening. Thank you so much.
Thank you. Thank you so much, Martin. Thank you so much, everyone, for coming in. We really do appreciate it. And let's keep the conversation going. You're very welcome for our Africa Dialogues, and we'll be sharing details on that, as well as our Africa Health International Conference agenda. Thank you so much, and enjoy the rest of the sessions that you're going to attend. Thank you.